And we are live. So before we start, do you consent to doing this interview?
Yes, I do.
All right. And do you consent to it being shared with my class for educational purposes?
Absolutely. Yes, I do.
Okay. Then do you want to introduce yourself?
Yes, I am Laura, and I have Cushing's disease or had Cushing's disease.
Do you want to give us a brief description or overview of Cushing's disease?
Yeah, so Cushing's, overall, Cushing's is basically your body producing too much cortisol, and your body being in a fight or flight mode, 24/7. The type I had was Cushing's disease, which is caused by a microedema in my pituitary that uh, produced too much ACTH, which then told my adrenal glands to produce too much cortisol.
Right. So a common physiological response to elevated levels of cortisol is edema, which is retention of fluids and swelling, elevated blood pressure, and it could even induce diabetes. Did you experience any of those symptoms?
I absolutely had the diabetes. I don't believe I had too much swelling. I did have significant weight gain, and I've been blessed that I have not had high blood pressure,
That is
but
good.
it is common.
Mhm. So, for patient screening, did your physician order a urine or blood test?
Yeah, so my the initial thought process was he did a blood test, just in general. My endocrinologist did a blood test, saw that I had high cortisol, then ordered a 24-hour urine test and a saliva test.
Right.
And then we did a low dose dexamethasone test.
Yeah, I was actually going to ask about the dexamethasone. And that's where they give you 1 milligram, and then to a person without Cushing's disease, it will make us not produce cortisol anymore. But if you do have Cushing's, then those levels will still be high.
Yep,
Right.
it does not suppress.
Right. Exactly. Were there additional methods employed to confirm the etiology, such as an MRI or a CT scan?
Yes, I did have an MRI, um, on a T3 MRI um, machine, and it did not show uh, any sort of tumor or microedema, but that's also, you're looking at a small tumor on a tiny gland in
Right.
your brain.
Right. Yeah, but it's hanging off of the hypothalamus there.
Yep.
So were they able to determine the location with inferior petrosal sinus sampling?
Oh, yes, I got to enjoy my time laying on a table while they did the IPSS.
Right. And that's where they catheterize the femoral veins, right? And then
Absolutely.
they go up to the temple veins
Yes.
and
And
then
you
they
can feel it and
oh
hear it,
wow.
and it's not pleasant at all.
Oh no. And then from that they actually take samples of the blood, right? And it should have
Yes.
elevated ACTH depending on the side. Right.
Yes. And I happen to have, I had elevated on both sides, but more so on one of my sides,
Yeah,
which gave them the opportunity to be able to know exactly where, kind of have a better idea of where to go in and
right,
look for the tumor.
right. So for treating the tumor, how did you have it treated?
Yeah, I had I can't remember what it's called,
Oh, the
uh,
transnasal?
transnasal surgery, where they go up through your nose and uh, scrape out or get out as much of the tumor as they could.
Right. And then, so from that surgery, did you experience any symptoms associated with neurosurgery injuries, such as loss of vision, double vision, or other brain injury?
I did not have loss of vision or double vision. I had loss of taste and loss of smell
Oh, okay.
through the nasal because of the going through the nasal passage.
Mhm.
Um,
Uh,
I
did
had
those senses
lots of
return?
headaches.
Oh, That's not good.
Very extreme headaches for for a couple weeks.
Oh, that's no fun.
No,
Did those senses return?
yes,
That's
thank God.
good. Okay.
I lived
That
on
is good.
McDonald's French fries and with ketchup and hot sauce because all I could do is taste sweet and hot, or
Oh,
sweet and
weird.
spicy.
Wow. Um, and then you said that you also needed stereotactic radiosurgery, right? Which is a gamma knife.
I did. Unfortunately, my transnasal surgery was not fully successful. So I ended up having to have gamma knife radiation, where they uh, screw a halo into your head while you're awake. Uh, and then you have MRIs, and then they do radiation, one time pinpoint radiation uh, to get the to your pituitary to get the rest of the tumor out.
Right. And then that takes some time to have an effect, though, doesn't it?
Yes, it does. It takes about a year,
Mhm.
and or year and a half sometimes. So I was on a drug called Isturisa, um, which is a Cushing's drug, and I was on that until um, I started actually kind of going into somewhat of a crisis, based on the radiosurgery had worked. My pituitary no longer worked, and then
Oh,
I was also medicating it.
right,
But that's when we discovered that things got fixed
right.
too well.
That is, oh boy. Um, if were you treated by chemotherapy at all? Did you have any of that?
No.
Okay. So are you on any medications to further treat the condition
Oh,
since
yes,
your pituitary gland took damage?
absolutely. So I'm now considered pan-hypopit. Basically, all of my hormones and any of the functions, or most of the functions that my pituitary gland did, uh, no longer does. So I am on Cortef for hydrocortisone or hydrocortisone, so a replacement cortisol because now my body doesn't want to replace any of it. My I am on Norditropin, or it's also called somatropin. That is an injection every day, and that is for insulin growth hormone deficiency. I am on levothyroxine every day, and that is due to my thyroid not
Right,
working.
right,
And I do have a prescription for Solu-Cortef, which is an injectable um, hydrocortisol for emergencies only,
right.
which I've not had to take yet, thankfully.
That's good. So one of the medications you mentioned was levothyroxine.
Yeah,
One of the common side effects is drowsiness. Do you ever feel sleepier than normal?
I take it at night.
Okay,
Um, and I don't know that I really feel any drowsier. I still have issues with like insomnia, so I imagine that's not really doing much.
right. Okay. Would you say that your life has improved after diagnosis and treatment?
That is a hard one to answer, Steve. Unfortunately, uh, Cushing's, or well, fortunately, Cushing's, I had diabetes. I was 100 pounds heavier. I was at risk for cardiovascular issues, um, and lots of terrible things that go along with that. Um, Now having had that treated, I did, lose 100 pounds. I'm no longer diabetic. It's not even on my, list of diagnostics.
That is
Um,
good.
but, I do now have um, uh, secondary adrenal insufficiency, panhypopit, due to my pituitary no longer functioning at all. So they did a little too good,
Right.
but I actually asked my doctor that the other day. I asked my endocrinologist, you know, what is better? Should I have just not dealt with this. And he said, absolutely not. Cushing's is essentially, asking for a death threat or a death sentence. And treating it, if he had to do it for himself, he would absolutely treat.
Right. Do you have any advice for other patients who might be living with this condition?
Yes, I would definitely say advocate for yourself. If you don't have a doctor or an endocrinologist that will agree to test for cortisol, and you believe you have it, a high cortisol, if you believe you're experiencing the symptoms, I would say find another doctor.
Right.
Keep advocating for yourself. We are lucky to have one of the best endocrinologists that specializes in Cushing's in the greater Cincinnati, Northern Kentucky area, but not everywhere has them, and not
Right.
everyone can see him.
Right. Right. And do you know of any support groups for people living with Cushing's disease that you'd like to share?
Yes, I don't know the specific names, or I can't remember the specific names,
That's
but
okay.
definitely on Facebook, I joined a couple of different Cushing support groups. They're not local, they're definitely virtual, but it's nice to be able to kind of commiserate with others, also learn from others, seeing, kind of getting an idea of what to expect when you're going through a different testing or different procedures, finding doctors in your area because we all share the best ones and the worst ones.
Right.
And yeah, I think just getting online and definitely not through social media, there's some great support groups out there.
That is awesome.
Yeah,
All right. That's everything that I had for today. So thank you for talking with me. You've been a great guest. And I hope that this gives, some opportunity for people to learn about this.
absolutely. I'm glad to have the platform. So thank you.
No, thank you.